let me know.
Will do, ma'am.
Okay, we are live on YouTube and UGTV. Good to go.
Ready when you are, Commissioner Bynum.
Okay. Let's go ahead and get started. I'm sorry, I have a dog in quarantine behind me, so you might hear some squealing. But we will call the Public Works and Safety Standing Committee meeting for December 14 to order. And as I call the meeting to order, I do want to announce that due to COVID-19, some committee members, staff, and public are attending remotely by Zoom, as well as some on site. All participants joining by phone should mute their phones when not speaking to avoid background noise. And during our meeting, make sure you announce yourself by name and title when you speak so the public knows who is speaking. This is critical given the number of remote participants, and it's also guidance from our Kansas Attorney General. Due to COVID-19 requirements, in-person public comment has been suspended unless otherwise required by law. The public is allowed to participate by Zoom or submit comments by email prior to the meeting, and those comments will be included in the record of our meeting. And now I will call the meeting of Public Works and Safety Standing Committee to order and ask the clerk to call the roll.
Roll call. Groneman. Philbrook.
Here.
Kane.
Here.
Ramirez. Markley.
Here.
Bynum.
Here.
And Groneman.
Here, present.
Thank you. We don't have any revisions on tonight's agenda, and there are no minutes to consider, so we can go straight to our committee agenda for the evening. We have 3 items on the agenda tonight, and the first one is authorizing a survey of lands for Pump Station 15 abandonment project. I see Mr. James Bain is with us from legal. Would you take it away, James Bain?
Thank you, Commissioner, and good evening. Commissioners, this is James Bain, Unified Government Legal Department. This resolution declares the Pump Station 15 abandonment project to be necessary and a valid improvement project. The resolution authorizes a survey to determine the properties needed to complete the work. Kris Finger, project manager, I believe, is on the call to talk you through the project and answer any questions.
Thank you.
This is Commissioner Philbrook. Where is that located?
I think there's a map that was submitted.
Just tell me approximately.
Well,
I'm not going to dig all that out.
It is, well, I think I was thinking it could be shown on the screen. It is like
106 in Georgia.
Thanks, Mike.
And maybe Kris is having a hard time getting in.
Move for approval.
James, can you hear me?
Hey, there you are.
Sorry, I raised my hand. They had me in the public side. Hi, my name is Kris Finger. I'm a project engineer with Water Pollution Control Division of Public Works. This pump station project is located at about 103rd, 104th in Georgia. That's currently where the pump station is, just basically north of Sam's Club. This force main for this pump station ties into the Pump Station 50 force main, which is being abandoned as part of the Lower Connor Creek interceptor that's being constructed along 435 to go down to the new Wolcott treatment plant. So with the lack of a new conveyance or the overly large conveyance source of the Pump Station 50 force main, we're looking at options of how to abandon or realign the flows from Pump Station 15.
I second Mike Kane's motion to approve.
Got a
Commissioner Philbrook, sorry.
Thank you. We have a motion and a second for approval. Before we vote, are there questions or comments from our committee? And Madam Clerk, do we have any comments from the public?
No comments received.
Thank you very much. I will call roll, please.
Roll call, Groneman,
Aye.
Philbrook,
Aye.
Kane,
Aye.
Markley,
Aye.
Bynum.
Aye. And that carries. Thank you. Item 2 is a survey of lands for the 7th and Central Intersection Improvement Project. James Bain again.
James Bain, Unified Government Legal Department. This resolution declares the 7th and Central Intersection Improvement Project to be necessary and a valid improvement, and authorizes a survey to determine the easements that are needed to complete the project. Dave Clark is the project manager, and I believe he is on to give you more details about the project and answer any questions.
Thank you. I did have a question. We did receive a map of this in our packet, and I'm just curious. Right now, we are authorizing the survey for the project. But Dave, does it anticipate the closure of Simpson Avenue by chance?
Yes, we're still going through comments from KDOT about, well, I guess I should clarify first. Do you mean permanently, or do you mean just temporarily while the construction?
I meant permanently. That's not part of it, is it?
No, it's not.
Okay. Yeah, because makes a little triangle there. Okay, any other questions from the committee? Or Mr. Clark, did I interrupt? Are there things you want us to know?
No, it's just general geometric improvements to widen the radii at 7th and Central primarily, and then there's a mill and overlay as well that goes from Homer to Reynolds, and then on from Simpson to Tremont on Central Avenue.
Great.
Commissioner Mike Kane, move for approval.
Commissioner Philbrook, second.
All right, excellent. I will add that anytime we can widen a radii, I'm all in favor of it. Any comments from the public?
There were no comments received.
And roll call, please, on the motion.
Roll call, Groneman,
Aye.
Philbrook,
Aye.
Kane,
Aye.
Markley,
Aye.
Bynum.
Aye, and it carries. Thank you very much. The third item is, and the last item for our committee, is an ordinance that relates to towing or immobilizing motor vehicles from privately owned property. Do I see Chief York on the call tonight?
You see Major Anderson.
Excellent. Okay, Kent Anderson, if you would walk us through this discussion, please. And I think there's a presentation, is there not?
There is.
Okay. Kent, you're muted. There's no Major Anderson. Now you're not muted. Are you ready to go?
Can you hear me?
Yes.
Okay, Casey is going to be giving the presentation as well. And, but it's basically a private property tow ordinance that we asked legal to look into because we've had some issues with people parking on private property such as businesses, and then tow companies kind of coming for third parties and either towing their vehicle, hooking up their vehicle, and not allowing them to leave. Kind of like predatory, charging them fees once this is done. And that's kind of what this ordinance that Casey Myers has put together kind of looks at. I'll try to share the screen. Well, I thought it would work.
That's how it always goes.
Casey, you want to try to share yours and see if you have better luck?
You got it. It's on there.
Can you see it?
Yes.
Okay, I'll let you take over from here.
Okay, thank you. Good evening, commissioners. This is Casey Meyer, Unified Government Legal Department. In response to the police department's request, I pulled ordinances from some other nearby cities, which included Lenexa, Overland Park, Kansas City, Missouri, Wichita. I like to add that this ordinance was also requested by an outside attorney who represents some local tow companies who operate within Wyandotte County. And so that also was included in the motivation to propose this ordinance regarding tows from private property. So the purpose, as is included here, is I'm not going to read it to you, but in response to these kind of predatory practices from tow companies. And also there's a statute that requires, if we authorize tow from private property, that we include certain things in our ordinance. And so that is what is some of the language. Also, its purpose is to hopefully deter false vehicle theft reports, because a lot of times when people's vehicles are towed and they don't know where their car went, they make a theft report to the police department. And obviously to hopefully decrease any arguments or fighting that might happen when somebody's car is towed when they don't believe that they had proper notice. Okay. Kent, can you go? Thank you. So like I said, these sections only apply to privately owned property. As you know, we already have ordinances that apply to tows from public property. And these would be the ones without the consent of the vehicle owner or driver. So like when a third party is requesting that your vehicle be towed. This also includes immobilization, which we normally call booting, right? So when somebody puts a device on your tire that doesn't allow you to move your vehicle. Okay. Like I said, it doesn't apply to public streets. We already have ordinances for that. It doesn't apply for tows when they have a contract with our city, nor does it apply to requests by code enforcement personnel, law enforcement, or fire department personnel. Okay, so what is required in the ordinance? First of all, proper notice to the police department within 2 hours of the tow or immobilization. That's actually a statutory requirement under KSA 81103C, and that's obviously to notify the police department that someone's car has been towed and where it has been towed to. So the individual trying to find their car knows that they just need to call the tow company. Also, we included a section on mandatory disconnect. So if you come to the scene and your vehicle has not yet been connected to the tow truck, then they would be required to not connect your car for no charge. If it is connected already, then they would be required to remove your car upon a payment of a reasonable fee of not more than half of their posted rate. Their posted rate is their going rate. And later on, you'll see that their rates cannot exceed 120% of our city contract fees. Okay, notice and sign requirements. So except for property that's appurtenant to or part of a single family residence, which will include duplexes, townhomes, residential plan unit developments, or when notice is personally given to an owner or driver that the area is reserved or otherwise unavailable for unauthorized vehicles, or when a private property owner is just attempting to comply with our property maintenance code regarding inoperable vehicles. So in those situations, you won't need a sign, but you will need a sign in these locations. So the notice must be prominently placed at each primary driveway access, location. So when somebody comes on to the lot, they can actually see the sign. That was a big issue with some of these calls for service that Major Anderson was referencing earlier. Just to note, a sign that clearly indicates that the vehicles will be towed, or it's a towaway zone, or violators will be towed. The sign structure needs to be a permanent structure that has been there for at least 24 hours. And then, of course, we have a large code section that deals with signs. And so I didn't want to conflict with any of that. So everybody has to comply with the requirements of our Chapter 27, Division 2. Okay. Additionally, there's a section that provides owner access to their personal property for up to 48 hours after the tow. That's, again, a statutory requirement under KSA 81103C, unless, of course, that property is being held as evidence. And then the final is the maximum tow and storage fees, which shall not exceed 120% of the rates charged by city tow contracts. That's also establishing the maximum tow and storage fees is included as a requirement under KSA 81103C. Okay, and then these are the notice conditions for the boot. So we were having several issues where Major Anderson was including, a lot of times they might not tow your vehicle, they were just coming and they were attaching various things to vehicles, not allowing it to move. It wasn't always the standard boot that we're used to. Sometimes it was wires, chains, whatever. This section just requires that if you're going to boot somebody's vehicle, you put a notice on the driver's window indicating that if they start to try to drive with the boot on, that it might damage their vehicle. It includes the contact information that they can call for someone to remove the device. It also requires that the company that can remove the device have a 24-hour service for that, which is pretty common, and that they respond within 1 hour. Also, notification of when and why it was immobilized, and then the fee to remove the immobilization device shall not exceed $75.
I'd just like to add on some of the incidents that we went out on. They were putting large cables around the tires, and this is at night. If you didn't inspect your vehicle before you left, you wouldn't even know that it had been immobilized, that you couldn't drive away. So that's part of the PowerPoint.
And then finally, the penalty, it's just it's a Class C misdemeanor, which is punishable by a fine not to exceed $500 or 30 days in jail. And that's it.
It's Commissioner Bynum. Casey, the very last slide, the penalty.
Mm-hmm.
And who would that be imposed upon?
That would be imposed upon the person who didn't follow the requirements prior to actually towing the vehicle or immobilizing the vehicle. So in these situations, it would be the tow company, the tow operator, or the person who affixed the immobilization device.
Okay, so on a big commercial property where there's a big parking lot, for example, if the property owner did not have appropriate signage and requested the tow, then that property owner might receive that violation. Is that correct? Or would it still always be?
Sure, yes, but the intent of this is that if the property owner requests a tow and doesn't have proper signage, and then the responding tow company or the tow service or the mobilization service actually does it, then you could either ticket either the requester or the tow company. Most likely, Major Anderson, you would ticket the tow company, correct?
That's correct. That's the intent.
Okay. Just another quick question. If this vehicle is on my private property at my home, and they've left it, I would have the right to request that be towed. Is that right?
Correct.
Okay. Once this passes through our committee, it's going to make its way to the full commission, and I don't necessarily see that it's being fast tracked. So I'm guessing it's going to show up in January sometime. And then at what point, assuming it passes full commission, does it take effect as law?
After it's published, which is, Bridget, a couple weeks.
Okay. Generally a couple of weeks after the vote, it's published and then it's effective as law.
Yes.
Okay. Any other questions from the committee? Or any comments from the public received on this item?
No, Chairman, there were no comments received.
Okay. I would entertain a motion.
Commissioner Markley, move to approve.
Commissioner Philbrook, second.
Okay, we have a motion and a second on this. Roll call, please.
Roll call. Groneman,
Aye.
Philbrook,
Aye.
Kane,
Aye.
Markley,
Aye.
Bynum.
Aye. And that motion carries. Thank you very much. I do believe that is the last item on our agenda, so that concludes Public Works and Safety. Thanks for all the presenters being here to help us. And thank you to Tom Groneman for joining us. And I will turn this over to Commissioner Markley for Administration and Human Services.
Thank you very much. All right, Administration and Human Services Standing Committee. Before I call this meeting to order, I want to announce that due to COVID-19, some committee members, staff, and public are attending remotely via Zoom as well as on site. All participants joining by phone should mute their phones when not speaking to avoid background noise. During the meeting, please make sure you announce yourself by name and title every time you speak so the public that is observing knows who is speaking. This is critical given the number of remote participants and as current guidance from the Kansas Attorney General. Due to COVID-19 requirements, in-person public comment has been suspended unless otherwise required by law. The public is allowed to participate by Zoom or submit comments by email prior to the meeting, and those comments will be included in the record of the meeting. I will now call this meeting of the Administration and Human Services Standing Committee to order. Would the clerk please call the roll?
Roll call. Philbrook,
Here.
Kane,
Here.
Ramirez, Bynum.
Here.
Bynum,
Here.
Markley,
Here. We have one revision to tonight's agenda. Item number 2 has been added under the public agenda, which is the appearance of Vicki Freeman opposing the closing of bars and restaurants at 10 p.m. That's near the end of our agenda. That will be added in. We have no minutes to consider, so that takes us to our committee agenda. Item number 1 is a grant agreement for, I'll probably say this wrong, Radex Up or Radex Up, I'm not sure which. And Julianne Van Loo, our public health director, is going to present this item. Maybe, I don't see her yet.
No, Commissioner Markley, James Bain, Unified Government Legal. I'm actually appearing for Julianne tonight.
Great.
So the Radix grant is aimed at increasing testing capability among vulnerable populations. The funding will help cover the costs of health department employees and contractors who are managing all of the pop-up testing centers and in coordination with the Health Equity Task Force. Wyandotte County was selected for the opportunity based on the coordination with the nonprofit partners and the Health Equity Task Force that have been managing the pop-up testing efforts.
Commissioner Mike Kane, move for approval.
Bynum, second.
Any additional questions from the committee? And clerk, are there any comments from the public?
We did not receive any comments from the public.
I'm sorry, this is Commissioner Philbrook. So say that again, Mr. Bain, this money, and how much money is it, or?
It is $187,000, and it will be going to manage the pop-up testing sites that we've had throughout the community.
Okay, thank you. Is there a time limit on the expenditure of this, or what's the story?
It June 30th, 2021.
Okay, great. Thank you so much.
All right, any other questions? Roll call on the motion, please.
Roll call. Philbrook,
Aye.
Kane,
Aye.
Bynum,
Aye.
Markley.
Aye, thank you very much. Item number 2 is appointing Dr. Altaf Hossein as the district coroner. Staff is requesting that this item be fast-tracked to the December 17th full commission agenda. And I am not sure who is presenting this one. If someone would like to volunteer, I will take it.
If Mr. Chris Well's not on here, Chase Cook is also, I think, on here somewhere, Bridget, but I'm happy to cover it right now as well.
Chase has been added.
Welcome, Chase. You are, if you would like to unmute and present this item, we are prepared to listen.
Can you hear me?
I can.
Great. So this is just an agreement we've come with Dr. Hussein, who actually is currently the special district coroner that you guys appointed. I'm not too sure how long ago, but sometime this year or early or late last year. And then we, after the passing of Dr. Hancock, who was our district coroner for 40 plus years, we've been working to replace him. And after we sent out a notice of need roughly 2 months ago, we got one response, and it was Dr. Hussein. We have come to agreement with him, and we are now here presenting to you guys.
Are there any questions from the committee? And Madam Clerk, do we have any comments from the public?
Madam Chair, we did not receive any comments.
I have a question.
Go ahead, Commissioner.
I was under the impression there was at least one more.
Dr. Hussein was the only person who responded to the notice of need.
Okay, all right, thank you.
Commissioner Markley, it's Commissioner Bynum. Is it a contract for service, or will the gentleman become a unified government employee?
Chase, go ahead.
He'll be a subcontractor to us. He'll be no, he will not be a unified government employee.
Okay.
And
is it a 1-year agreement, or is it an extended? Will we renew it annually?
Per state statute, it'll be a 4-year agreement. However, it's based on the last time Dr. Hancock was appointed. So it will be actually 3 years that he will be appointed for, because Dr. Hancock was in the first year of his appointment.
I see. So it's filling out the current
The remainder of Dr. Hancock's term, yes.
Okay. Thank you.
Listen, Commissioner Markley, quick question. This is Commissioner Philbrook. Would you mind, Chase, telling the public why we need a coroner for Wyandotte County?
I'll turn that over to Casey. She has a little better.
I'm sure Casey understands it, and most of us do, but I think we just need to make it clear why we need that medical official.
Sure. First of all, it's a statutory requirement, but more importantly, they are the individual who approves all of our death certificates, make sure the forensic services are running smoothly and efficiently, and make sure all of our autopsies and records are getting reported to the Kansas Department of Health and Environment as they should be. So it's a very important position.
Yes, thank you. I appreciate that summary.
Any other questions? If not, I would welcome a motion.
Move for approval.
Bynum, second.
Roll call on the motion, please.
Roll call. Philbrook,
Aye.
Kane,
Aye.
Bynum,
Aye.
Markley.
Aye. Thank you very much. Item number 3 is an update on CARES Act funding. And oh, there, Crystal has appeared to provide that update to us.
Thank you so much, commissioners. Let me share my screen if I can, please. Chair Markley, can you see our CARES Act update?
I can.
Fantastic. As the commissioner said, my name is Crystal Sprague. I'm the lead for the CARES Act team for the Unified Government Wyandotte County. We're here tonight to give you yet another update on the CARES Act funding and how we are utilizing those dollars as a community. It seems like just a couple of weeks ago, I was here giving you an update, but I assure you that the last 2 weeks have been full of activity in preparation for vaccine, along with just wrapping up some projects that were funded under the CARES Act. Much work continues to be focused on responding to COVID-19, as well as a lot of our subrecipients or community partners continue to do their work in the community. A reminder of the Planning Committee's funding priorities in order to reimburse the local jurisdictions for allowable expenses, to strengthen our public and private health responses, to improve the adaptability of our taxing entities, and those were primarily our educational institutions, to grow requisite human and health services, and that's really where our social and human services agencies came into play, and then build in community resiliency, and that's where our small businesses, medium and small businesses were funded. I always try to give you an example of how our jurisdiction is responding and preparing for the next phases of the COVID-19 pandemic. So I bring you 3 new ones tonight. The first one is improved protection for public first responders. It goes without saying that our first responders are on the front lines when it comes to COVID contact and intervention. We've had many different projects be started and completed with CARES Act dollars at the Sheriff's Department, the Police Department, and also at the Fire Department. I give you an example of one here tonight. On the bottom left part of your screen, you'll see a very interesting silver box stuck to the ceiling of one of our fire stations. The fire department was able to put in a UV sanitation light in every single firehouse. They installed a total of 28. That project is completed. So this provides just an extra level of sanitation for our first responders in the fire department. The second I bring you tonight is remote citizen interaction. Our UG departments continue to, just like every other jurisdiction across the United States, change and evolve so that citizens can interact with their government agencies from remote locations or by appointment only. And the example I have for you tonight is the Treasury. The Treasury's been able to deal with social distancing requirements, as we have all been to the Treasury to renew our tags at some point or another. Then we understand the mass group of folks that can be in that spot all at one time. So the Treasury's been able to use CARES Act dollars to improve their social distancing, not only at their annex, but also getting prepared to transition for some additional services here at our main courthouse. And they've been able to install drop boxes to allow folks to drop information off and purchase some appointment software so that folks can come in and get their business taken care of with the Treasury by appointment. And the last item that I show you here is for vaccination preparation. I know that we've all heard that the vaccine that is being distributed must be stored at a very low temperature. In order for the health department to be able to accommodate these types of services and protect that valuable resource that is coming our way, they needed to increase their power supply. So building logistics and the health department have worked together. The picture you see here on the right side of your screen just as happened a few nights ago last week. We had some generators arrive and start the installation process so that we can ensure that those vaccine resources are protected. So just a little bit of information about what your local jurisdiction is doing with the CARES Act funding. Some of you, if not all of you, saw some updated information from the Economic Development Department last week. We wanted to make sure we highlighted it here in our CARES Act update for this month. We wanted to make sure that the Economic Development Department received the ample notice for their amazing work over the past 2 months. They were able to pool their resources together with alt cap funding and some current funding, in addition to the $825,000 CARES Act grant award, to be able to fund 85 businesses for a grant, much based on lost revenue during COVID required shutdowns and health orders. 67 of the 85 businesses had less than 25 employees. So I think that's really amazing for our community. Through cost savings and other projects, we have been able to identify just in the last week an additional $191,000 that will be sent over to the Economic Development Department so that they can continue that work and award some additional small business loan grants to be able to offset some revenue loss, as well as increase awards for agencies or businesses who received award but not at the level that they were requested. So that's some really great news. Some cost savings and programmatic changes within the unified government has allowed us to support our small businesses and local businesses at even a greater level. So all in all, the Economic Development Department in just the last 2 months has been able to award over $1 million to small businesses. And those small businesses were in 11 different zip codes. So hats off to them. They've been working amazingly hard and have been able to really assist our small businesses in our community. The third piece I'd like to go over with you tonight is the community-centered recovery subrecipients. You hear me say this all the time, but we were able to push in $9 million to medical education and human service agencies. That's no small task. And of course, handing the money or distributing the money, that was the easy part. Then our community subrecipients had to take it from there. A reminder of where those subrecipients are in their path. We've completed the second report cycle, and we're preparing for the third report cycle, which is due January the 4th, with a closeout being January the 14th. And a note here regarding one of our subrecipients, or a group of our subrecipients. The name of the game for COVID-19 has been quick and agile response. Our local health department has been a great example of this and was able to notice need in our community for emergency cold weather shelter. They have been able to isolate $52,000, provide some direct guidelines for setup and operation of such a shelter, and the requirements to set up that shelter so that it is safe and reduces the risk of infection. They've identified the need for the safe and healthy crisis housing and able to extend with our community partners a quick setup of an emergency cold weather shelter. I think this speaks to the swift action our community organizations in partnership with government can accomplish. This has been just 3 weeks in the making, and I know that work has already begun to open 20 beds on Central Avenue to allow for a healthy crisis cold weather shelter when it's needed the most. So the big answer is we're in December now, and what's the spend down look like? So we thought it important to bring you tonight the spend down for our community organizations. We break our community organizations into two pieces. The first being the direct transfers. These are the programs. Much of the category here is filled with our local cities, Edwardsville and Bonner, our educational institutions, our hospitals, our medical response agencies. For the most part, the state identifies these direct transfer agencies as not new programs. These were existing programs, existing efforts that had reimbursables that needed to be addressed or needed to expand their services. So you can see to date, we've had $5.8 million dispersed prior to December 1st. We've got 8% or $500,000 that will be dispersed for certain in December. And that leaves us with about 3% or $185,000, which we call problematic. These are not cases in which we believe that these dollars will not be spent, but as a review, the requirement that the subrecipients were under was get your money in October, report in November. If you were able to spend down and show verification of that spend by 40% on that November reporting, then we release the second or the remaining 50% of your grant award. And then on your second report, which was due December 4th, if you could show a 60% verified spend down, then you were in compliance with reporting. This was no small task for these community agencies. You heard me say that many of them got funds in the middle of October, some even at the beginning of November. So they have worked very diligently to get to the place that they're at today. The 3% of problematic spend has to do with 4 agencies. 3 of those agencies have not met their spend down requirements, but we believe after consultation and reporting in December that they will be able to do so. 1 agency has failed to submit any reporting, and we've been able to issue formal notification that we need to get a report from them, or they risk losing the $22,000 that's on the board here. So the second group of community partners are our programs. So think of these as our direct aid. These are brand new programs. A good example of this would be YDEC, where they are starting something new in response, not necessarily a reimbursement, but a program. So this is a smaller group than the previous group before, but they have the same reporting requirements to us. Their reporting requirements to the state are a little heightened. We must show exact spend down before we can consider our money spent here at the unified government. But our release of dollars was the same and our methodology was the same. So in this group, we look at them in 2 ways, not only our disbursement across the unified government, but also what the programs have actually expended. So when we look at disbursement, we've had $3.2 million dispersed to this group, and an expected disbursement in December of $645,000. That leaves us with $243,000 as problematic. We have a lessened concern in this area for this problematic spend because 2 of the agencies make up $190,000 of these dollars that have not shown spent. And those 2 agencies are rather large and mature agencies, and we believe that they will be able to move through their spending in the month of December adequately. It should be noted that this group has already spent 66% of their dollars. And again, they only received their dollars at most 6 weeks ago, so they still have 4 weeks of spend left before we get down to the wire here on December 30th. So a little time perspective, our report is focused on how much was expended or the projects that were completed prior to December 1st, but today is not December 1st and we have 16 days left. So please, good thoughts out to our subrecipients and to our unified government departments as we tie up some loose ends. We do have a couple of reporting requirements that come in January for reconciliation, but we know that we'll have more progress to share with you when we come back in middle of January. Does anybody have any questions for us?
Commissioner Mike Kane, I do.
Yes, sir.
Could you go back to the slide where you showed the thing they installed for the firefighters?
Sure.
Okay, perfect. And where it says improve protection for first responders. I am hoping that obviously our nurses and our senior citizen homes and stuff like that should obviously be first, but I would think that we would want to give the police, the sheriffs, and the firefighters access to the shots immediately, because they are exposed on a regular basis, all day, every day. So I think that that's something that we really need to consider. You know, I don't, some of the states are saying they're going to get it, some of them they aren't. I think as a municipality, we should put those at the top of the list.
Commissioner, this is Alan Howes, Assistant County Administrator, and the health department is following KDHE guidelines and kind of filling in additional details. And I know that first responders are at the top of the list and among those who will be in that first group that gets that vaccine protection. Absolutely.
Thank you very much. And as always, Crystal, you guys do a great job. We appreciate you.
Thank you, Commissioner.
Yeah, definitely. Appreciation. Other questions? Commissioner Philbrook, did you have a question?
Yeah, just a comment. As usual, Crystal, you guys are just, I don't know, rock stars. And I can't thank you enough for how you've reacted and worked with your team. You guys have a phenomenal team. So, Alan, congratulations on having a phenomenal team working with you. And thank you again, Crystal. And I know we're not done yet, so thanks.
Thank you, much appreciated. And I know several members of my team are listening today, as well as other department heads and community organizations. So I'd like to take a tiny bit of the credit, but I can't. These guys are working themselves to the bone. And I will tell you that I have not had an experience with one department or one community agency who has not been dedicated with their eye on the prize. You know, we like to say, are you sure it's December 30th? But everyone is focused on not just spend down, not just spending dollars, but spending eligible dollars that are ethically spent for the right reasons and fit the need of our community.
Thank you for making that comment, because, you know, I do get to talk to a few of those care providers, and I know that that is definitely at the top of their list, is caring ethically for our community. And so we are very blessed. We have probably one of the best communities in the metro to do this kind of work. So thank you.
Commissioner, it's been a team effort, I think, from the very beginning, from the commission involvement through the setup and of the staff team, through the kind of the execution and ideas that were brought forward by departments. And I think we've seen a tremendous amount of progress in support for the community in a relatively short period of time. And we're hopeful that additional resources for the federal government will be forthcoming in 2021, because there's a lot of work left to be done in the distribution of vaccines and the continued work to protect the health and the economic vitality of our community.
Thanks, Alan, for saying that. And I'm going to jump out on that skinny branch and tell people when they listen to this, or if they're present now, that if they pray, please pray that we continue to find the finances to care for the folks that need it. Thank you.
Crystal, it's Commissioner Bynum. I'm curious, we've got a small amount of money that's possibly unexpended. Is there any sort of planning taking place? For example, if it's December 28th and we've got 150,000, is there a plan in place now to immediately shift that into the hands of an agency that can expend it, for example, on food, rent, utilities by the 30th?
Well, Commissioner, first I'll say our goal is not to have that conversation on the 28th or the 29th first, and I know that everyone here is aware of that. But secondly, the planning committee gave us some really good direction. I know it sounds like way back in July, but gave us some really good direction back in July that said if there were a few dollars left on the table in those sub-recipient categories, that we would use the formula for the local jurisdictions, Bonner Springs and Edwardsville, and reappropriate those dollars. And both of those agencies have reimbursables that exceeded their original award. And I would say, I'm going to go out on the little skinny branch that Commissioner Philbrook went out on a minute ago, or maybe a different one. I think that we might have $22,000 remaining, but I'm really confident that the other agencies that I had listed in those problematic areas just need an extra couple of weeks to get their dollars in the hands of the citizens that they're serving.
Okay, thank you very much.
Are there additional questions, or Madam Clerk, did we have any comments from the public?
We did not have any from the public.
This item was for information only, so if there are no further questions, we will thank Crystal and her entire committee for their time, and we can move on to the remaining items on our agenda. Thanks so much, Crystal. All right, our public agenda is our final agenda set of items. We have two public presentations tonight. Kimberly Pond is requesting to appear regarding the 10 p.m. closing rule being changed to midnight. Ms. Pond, I see, has been moved into our panel. Ms. Pond, please state your name and your residency for the record, and you'll be given up to 5 minutes to make your comment to the commission. Ms. Pond?
Hi, I'm sorry about that.
Oh, you're fine.
My name is Kimberly Pond. I'm the owner of Red Eye Bar on 61st and State Avenue. And I just wanted to put a few things out there about my concerns about closing at 10 versus midnight. I am extremely happy with the way Wyandotte County is moving forward on the virus protection of the people. My only concern is that people that work in Wyandotte County that do like to go to bars and restaurants are heading to Johnson County now, spending their Wyandotte County money elsewhere. They're moving to other counties out west of Wyandotte County that have no restrictions. Our bar and many other bars in our area have the setup where we have the hand sanitizers, the masks, everything in place, in order. We're following everything because we don't want everybody to get sick either. But to take away 4 hours of income versus 2, it's hurting us. And it's hurting the people, the local people that do like to go out and do like to socialize, whether it be a charity event, if they like to play pool, whatever they like to do, they're doing it in other counties now. And we took a hard hit when we had to shut down for 3 months. I understand it. I'm behind it 100%. But as a small business owner, it hurt. It hurt bad. And now the 10 o'clock closing we're seeing the same repercussions where we're not getting as many people. The income's not coming in, but the bills are still there, of course. I would like to know if we could get a better communication system opened up to tell us how long are we closed down till 10 o'clock? What happens to the people that do not close down at 10 o'clock? What are the repercussions for them? And is there a possibility of getting it reversed and closed down at midnight versus 10 o'clock? The majority of my clientele is going to Johnson County. I'm going to be straight up forward with you. They did start at 10 o'clock, and then small bars went to Olathe, and I don't know what they said. I didn't participate because I only care about Wyandotte County, but they got theirs moved to midnight. And I've noticed just recently, Independence, Missouri, theirs has been moved to midnight. I don't understand why our casinos can be open past, 2 o'clock in the morning. I know they stopped selling alcohol at 10 o'clock. I understand that, but they get to stay open. What does alcohol stop being served at 10 o'clock? How is that helping? And I would like to see a little bit better communication from Wyandotte County as far as to the business owners, like emails or a letter in the mail, which emails would be, cost efficient. So we know. I'm always having to look it up on Facebook and other social media places that I don't normally spend a lot of time on, just so I can find out, oh, am I going to get in trouble? Am I doing something wrong? Because nobody's communicated to me what to do. We care about our people. And like I said, kudos to all of you. I have noticed a lot of good things from everything you're doing, the implementations, but we need a
1 minute remaining.
I'm sorry, what?
You have 1 minute remaining.
Okay, I'm done. I'm done. No, I'm done. Really, I didn't want to repeat myself.
All right. Well, thank you very much for your comments. Our final item this evening is also a public appearance. It is by Vicki Freeman, and on the same topic of closing bars and restaurants at 10 p.m. Ms. Freeman. Oh, we're just swapping. We're swapping.
We're moving the, yeah.
Camera. I was
sorry.
going to say, I don't see her on my screen. So Ms. Freeman, please state your name and your city of residence, and you also will have 5 minutes to state your comment.
Thank you. My name is Vicki Freeman. I own, manage, and work at Kobe's Bar and Grill in Bonner Springs, Kansas. I've been a lifelong resident of Wyandotte County. Kobe's has been a female-owned tax-paying business for 33 years. My business pays separate taxes, sales tax, liquor tax, food tax, beer tax, personal property tax, real estate tax, utilities, insurance, and employee tax. I've never had a health issue, code violation. It's been a struggle, but I've gone over and above to meet or exceed all requirements and requests or that's on your mandates. Prior to COVID-19, Kobe's has employed up to 20 full-time and part-time employees. Since your restrictions regarding closing times and capacity requirements, Kobe's now only employs 9 full and part-time employees. Customers are now patronizing other establishments where they are not hindered by these restrictions. Kobe's is less than 2 miles from Johnson County. Establishments are allowed to stay open till midnight, and 3 miles from Leavenworth County's businesses, which have no restrictions at all. The complex combination of the restrictions and geography continue to drive businesses down for myself and other small businesses owners of this county. I respectfully request that you favorably consider changing the closing time as it stands now from 10 p.m. to midnight to allow an additional 2 hours of service time. This will be this will by no means account for lost revenue created for by those restrictions, but it will indicate to us that you are making a distinct effort to assist us with these ongoing matters. Thank you very much.
I just wanted to pop in real quick. I'm Councilman Mackey, and I'm on Bonner Springs Council. I just wanted to mention that we haven't had any complaints or issues from Kobe's or
the Red Eye.
Yeah, or the Red Eye from either one of the establishments. And I mean, there has been some other restaurants, but they've abided by every single thing that or any level of the mandate that has came through, from the mask ordinance to the cleaning to every single, I mean, from the social distancing, closing. And I would like to concur with both restaurant owners that we would like to try and seek the 12 o'clock concurrence with Johnson County and Leavenworth. That's all we're asking, is just to be able to meet the surrounding counties. That's all. Thanks, guys.
Thank you.
Thank you very much for your comments this evening, all three of you. I should clarify for the public, because this is a confusing issue. Health orders come from the health department, and they are not items for commission approval. So this is not an item on our agenda tonight that we could take action on, and it's not an item that would come to the commission in that format. However, this commission does have regular interaction with the health department, and I trust each commissioner will carry your thoughts forward in those discussions with the health department. If there are items, staff members who are on the phone, if there are items there were questions about how I think Kimberly perhaps had some questions about how things were enforced and those sorts of questions. I would request that staff get with the clerk's office to get contact information to be able to answer those questions for you. I would try to answer them myself. I think I know the answers, but I'm afraid I would be incorrect. So I will allow someone on staff to try to make that contact to answer those questions and make sure that you have the correct information on those items. All right, that was our final item for this evening. I thank everyone for their attendance, including our